Thank you, Steve. It was a lot of nice work. It was good. So Peter DePippo, that was a great presentation, and I really liked seeing that lab at the center of that slide there, so that was nice to see. So again, I'm Sarah Wright from the Association of Public Health Laboratories, and I'd like to give you a nationwide look on private well water testing at our public health laboratories. So let's see how this works here. Oh, there we go. That's a nice monitor. Okay, so who is APHL and what do we do? What was our private well water survey method? What were our private well water survey results? And what are the general takeaways and next steps from this? So who is APHL and what do we do? Okay, so Association of Public Health Laboratories. So that's not where I work, but that's the Utah Public Health Laboratory, a beautiful building. So there are 50 state public health laboratories and then also city and county public health laboratories. They test for things that might make a community sick. So that might be mosquitoes and people for Zika virus. That might be food for salmonella or private well water for manganese. I heard earlier that that was a unheralded contaminant. So there are public health laboratories in general, and then there are also agricultural laboratories, chemistry laboratories, environmental laboratories. Sometimes that environmental laboratory is set up within the state public health laboratory or the city or county public health laboratory, but regardless, they are all sort of public health laboratories in our minds. Our job at APHL is to strengthen that public health laboratory network, and that's through communications, training, convening, and advocacy. And my job as environmental laboratory senior specialist is to work with the environmental laboratory system specifically, the ones that test air, water, and soil, and then those are also the ones that happen to test private well water, so here I am. And we decided to do that survey. So what was that private well water survey method? So what are the capabilities and capacities of the public health laboratory as far as it comes to private well water? So back in February, we started talking about this. We developed the survey in collaboration with 3 member labs. I'd like to thank Lou Barinelli from New Hampshire Public Health Laboratory, Marianne Hagerman from Indiana, and also Tammy Tyson out of Saginaw County Public Health Laboratory for their instrumental help with that, and also Steve. It was 12 questions, but honestly it was 24 because we had like a 7E and that type of thing. We did it through Qualtrics, which was a great tool. By the time we got it done and everything, April 11th, we were able to send it out to 37 state public health laboratories, or including the environmental laboratories. And then the next day, we sent it out to the APHL local lab director listserv, and then just about 12 days ago or so, the survey closed. So this is the opening survey page, just for your reference. All that information is redacted because it was supposed to be an anonymous survey. And what were the results? What's the good stuff? So 26 state laboratories completed the survey, and 14 local laboratories completed it. But then who actually had to finish all those 24 questions? Well, 18 states said that they accepted private well water samples from the general public, and 8 local laboratories did. We're also curious to see, did they accept unregulated drinking water samples from outside of the jurisdiction? Half of the states did, but all the locals, and you can imagine that's because of distance. How many private well water samples do they accept from the general public? That they accept from the general public, do they analyze annually? And there are 3, so the red bars are the local laboratories and the orange bars are the state laboratories. There are 3 kind of main ranges of how many samples that they analyze. So 7 states analyzed between 10 and 2,000 samples a year. 9 states analyzed between 3 and 8,000, and then 2 between 20,000 and 50,000. Any guess as to who the 20,000 and 50,000 were? Which states?
New Jersey.
No. We talked about this lab earlier today, that they do a lot of good outreach, but the most was Wisconsin, it says 50,000, and then Maine was followed with 20,000. Now, there are other states that we didn't get captured in this survey, but they certainly do a lot for private well water testing. For the locals, so between 60, so 3 locals tested between 60 and 100 samples, 3 locals tested between 900 and 1650, and then 2 were kind of the outliers, again with 3 to 4,000. And those are typically county labs that were outside of a major metropolitan area. So it was an anonymous survey, but I did ask the permission of those labs to mention the ones that were outliers. Okay, so what are the other sources besides of unregulated drinking water that these labs might test? So I enjoyed the talk earlier on the springs. So a little less than half said that, of the labs said that they did test something other than wells, whether it's cisterns, ponds, springs. 3 states tested all 3 of those things, and then it was a sort of a random combination of other ones. Other unregulated drinking water sample sources, or things that wouldn't commonly go through the public or regulated system in a way. So the surface water, they said they also got some drinking water samples from that, and then other individuals that wanted to test their public water systems in addition to the regulatory purposes. One thing I do want to mention with that is that a lot of the times the labs don't actually know where the sample originated from, just that it's drinking water, so it's possible that this is underrepresented. So what do the labs provide the private well water customers with? Well, almost 100% provided them with bottles. Almost 100% provided with written sampling instructions. And then of those people at the labs that provided written sampling instructions, they also might have provided additional verbal sampling instructions. That was never on its own. About 2/3 of labs provided guidance on which analytes to sample. And one thing that was interesting, so North Carolina, they said that they had a new, I don't know if it's a new regulation or not, but basically saying that newly constructed wells must be tested for a mandatory list of analytes. So they had to provide that as far as the guidance. And then coolers for transport, so a lot more states provided that than locals just because of the distance issues. So do the labs go out and get their hands dirty sometimes? But mainly they're focusing on the testing. But there were a few states that did. And the reason why they would do that to physically collect the private well water samples was because maybe a specific analyte that had more complaints than others, and so they need to make sure that the sample was collected correctly. Other times there are also studies. So we had an interesting study. There's one state that's doing a biomonitoring study of where they're collecting urine and blood and testing for various metals and then matching that with the private well water that they're drinking. And so the state would go out and collect it to make sure that those study results were consistent. As far as fee-for-service, so how did the laboratories fund the private well water analysis? Most of it is fee-for-service, so they try to dictate that fee based upon what they need to cover their costs. There were some laboratories, though, that had a general fund or maybe a dedicated laboratory account that would support that based upon the state's or the local needs if they said that they were going to provide free testing. And then also there was a case where at the biomonitoring grant where that was funded separately. What partners do you work with? So this conference is basically about partnerships. The state and local laboratories, so only 2 and 1 state and local laboratory respectively did not work with any partners. 3 states work with all the State Department of Health, State Department of Environment, and local Department of Health. Some interesting other categories that I thought would be of interest to this group. So doctors' offices, community groups, well drillers, pump installers, and plumbers. And just like any profession, the labs that really stand out are the ones with really passionate individuals that want to make a difference within that program and or create great partnerships. And that's what a lot of these labs have done. So how many analytes does your laboratory provide private well water testing services for? So I switched the colors up on you. Sorry about that, just to keep you awake. But so the orange color is the local laboratories, and the red color is the state laboratories. Let me just make sure I have my notes here. So for the states, there are 3 different kind of ranges of the number of analytes that they would test as far as for private well water specifically. And so 10 or 11 states said that they would provide testing services for less than 25 private well water analytes. Only about 4 did 1 or 2, and that was commonly bacteria. 2 state labs said that they would test between 40 and 50 analytes, and 3 to 4 said that they would test for over 100. Locals, we had 3 that would test just for 1. One that tested for 5 analytes, one offering 10, another one offering 15 plus the volatile organic compounds. What was interesting though too is that, so this question said, how many analytes does your laboratory provide private well water testing services for? So that was worded to, specifically for private well water testing, but many of them answer that, yes, we do this 20 or so for the private well water testing, but we have capabilities of over 100 analytes or whatever. So that could be an opportunity for studies that you could partner with or with the labs on, or whatever might be needed in that region. If there's a new contaminant that you're not aware of, maybe that state lab has that capability to test for. It's just not listed within the private well water testing menu. So that's just an example of trying to go and contact your state laboratory or local laboratory on those issues. We were curious about how how the laboratories provided the water testing menus, and so is it individual analytes or panels or packages? And a lot of them provided it through individual analytes, but then they were also presented as full panels, and then maybe routine and regulatory, coliform only, anions only, cations only. One other state mentioned that they have homeowners packages, HUD or FHA, VA loan packages, standard water quality analysis. So just kind of interesting to see those differences. So what are the most frequent analytes that the laboratories would test for? So these are the most common that popped up from this survey. So total coliform and E. coli were the top for the states and the locals. For states, arsenic came next, followed by lead and nitrates and nitrites, whereas the locals were more focused on the nitrates, nitrites, and then fluorides. So there's the 7E questions. For this one, we wanted to get a sense of the variability between the laboratories as far as methods, and then maybe there's a difference in turnaround time or the fees, something like that. So that's why we asked these questions coming up. And then just to show you a couple of examples. So this is total coliform. One thing about the method, so there can be various methods that the lab will do, but is that laboratory certified to perform that method? Is that data that they're going to produce, is it going to be defensible in quality? And that's a big emphasis for us. As far as the testing fee goes, most people would, it's hopefully affordable for most people, but that's quite a range. $0 is not $25. And so just based upon different circumstances for different labs, that they have provided those different testing fees. We have heard from labs that they are sometimes they cannot compete with commercial labs. And so maybe they can't do under, or maybe they have to do exactly as is. So kind of an interesting situation that sometimes they're put in. The average turnaround time can vary. So with total coliform in particular, so between 24 hours and less than 5 days for the states, or 24 hours and 2 days for the locals. If that's an issue, maybe in some program or something, I would encourage you to go out, reach out to your lab and see if they can do a shorter turnaround time if need be for some particular reason. But that's typically because of logistics or staff, staffing issues, or maybe there are certain samples that are of higher importance than others. So here's E. coli, it's very similar. Nitrates. Wanted to show the 3 different methods there. So there can be a lot of variability within the lab methods, but they've been tested and hopefully should give the result that is needed. With the nitrates, sometimes that's part of a panel versus an individual analyte as far as how that is, the fee that goes along with that. With the arsenic, one thing I wanted to point out is, so the 20,000, so that's Maine, again. And then the average turnaround time, so just the high-end one, the 43 days, that was for the biomonitoring study. Lead and arsenic have the same method, EPA method, 200.8. Okay, so then once they have that turnaround time, they receive the sample, they push out the results, do they communicate those directly to the customer? And 13 states did and 7 locals did. Of those people that communicated directly, I checked the results, all of them provided some sort of additional guidance as to what that meant. There's a variety of what they provided, whether it was info or guidance related to safety and quality of the water, comparison to USEPA primary and secondary contaminant levels, but all of them provided something. How do you provide your results to your customers? So US Postal Service is winning out still, which is good, but we heard earlier, I think that they prefer it that way. But emails coming up and coming as well. One thing of note is just that sometimes if there was an acute health risk, that they would actually call that person directly, or sometimes they would go out and see them to make sure that they understood what those results meant. And then the wave of the future, so the LIMS system, so that's the Laboratory Information Management System that will directly fax. So it's kind of like, well, that's the wave of the future, but to fax, I don't know if it's, exactly. maybe it's more cyber secure, I'm not sure. As far as the survey results, okay, so the biggest barriers. So we are curious, we all talk about the barriers in this room quite a bit, but what are the biggest barriers that laboratories think that homeowners have when deciding to test their wells? And lack of awareness was the highest as far as the number. So we asked them, check all of the above, as many as you want as far as the barriers, and then rank them as well. And so lack of awareness came up as far as being the highest number, and then also it was ranked number 1 the most number of times. Complacency and cost were also an issue. Some laboratories were concerned that access to sampling supplies and drop-off was also an issue, but sometimes they just didn't know as well, so they reflected that in the survey. So if lack of awareness is an issue, do these labs promote the private well sampling program? And so a little less than half do out of the states and the locals, but we get back to an earlier comment that I said, is that sometimes, or I don't know if I said that right yet, but sometimes they cannot promote what they're doing. Sometimes they cannot advertise. Sometimes they cannot compete with the commercial laboratories. And so that might be part of why it's just a little less than half. But some of the interesting ways that they would promote their private well sampling program was through state fairs or conducting private well water testing forums, supporting community-wide sample collection events. I also thought it was interesting that during emergencies, they would actually advertise, and maybe it would be free testing in some cases. So this is skipping to question 12. We missed question 11, but so these are some of the pictures just to show you some examples from our lab. So this is the Oklahoma Environmental Laboratory and some of the wells that they've been sampling. This is North Carolina Public Health Laboratory. So on the top left, you'll see a sampling kit that they're about to mail out. Top right is a sample kit that they've received back, and then at the bottom is them hard at work in the lab trying to analyze all those samples. So general takeaways and next steps. So we see through the survey results that there's lots of variability in lab capabilities and how they interact with the well owners, the system, what they offer, and what they're allowed to do. But the commonalities is that many times that they will offer E. coli or total coliform tests at a minimum. They'll provide the bottles and the written sampling instructions. Most are fee for service, and they usually have greater capabilities than what is advertised. So this is kind of getting at question 11, which I didn't specifically write out, but I asked the labs if there's anything that you would like me to communicate to this audience of the private well stakeholders, what would you want me to communicate? And they, so based upon the survey and what they said, they recognize that awareness is an issue with well owners. They recognize the value of partnering with experts who can give health advice. And they also think sometimes the lack of regulations makes this an even bigger challenge. As I emphasized before, sometimes they're not allowed to advertise, but with partners, you all can. And so that might be a good way to partner in the future. A certified lab is highly recommended. Some public health labs may be able to trend the data to determine what the regional issues and challenges are, and they're eager to find partners. So next steps for us, so we've talked about maybe creating a best practices sheet for laboratories and how they engage with the greater system or kind of internal laboratory practices as it relates to private well water. I'd like to invite every one of you, if you want to get in touch with the laboratory, try to work with your county or city public health laboratory, your state laboratory. If not, contact me. I can get you in touch with that. If you want to look at a broader picture of things, maybe that's something that you and I can work together on. But basically, we were willing, this is from one of our county labs. She was saying that we were willing to partner with your division to help make this process as easy as we can for the client. Please reach out to us. Let's have a conversation and develop a strong partnership. I'd like to acknowledge the state and local laboratories who participated in the survey, my colleagues at APHL, Institutional Research, and also the private well class for inviting me here and for all your help and support and partnership along the way. And here's my contact information. Oops. Any questions?
Thanks for that. That was really interesting.
Thank you.
I come from the public health department, and I'm a health communicator by training. And one of the things we struggled with, we actually had a conversation about this at lunch, is laboratory reports are so difficult for a resident to understand. And so I wondered if through APHL there's an opportunity in that best practice guide to help labs have more consumer-friendly reports.
Yeah. I think that's a great idea. Yeah,
Okay.
that's definitely something that we'd love to. If it was a best practices kind of resource guide or whatever, that would be something that we put in there as an example report, maybe a couple, but that are model and as maybe indicate which ones work well for particular situations.
Yeah, and I'd be interested to hear if other states have lab reports, public health lab reports that they're happy with, because I've yet to see one that I find.
Thank you for your honesty. It seems like that's definitely an issue to address.
I was wondering if you had any anecdotes about maybe private labs that had given data over to public health labs to help bridge gaps in data coverage where they may not have the reach, the public health lab may not have the reach.
That's a good question. I can't think of anything off the top of my head where I've heard from our members about that, but I can ask some people and get back to you.
In Vermont, private labs has to report all their results to the public health laboratory, and then we get them. The public health department gets the data into a database and store all that data together.
Thank you.
So in Minnesota, our public health lab, state public health, does not take private well samples unless it's a special study or something. But our counties, a lot of counties do. But if we're asked, we say, well, we want we recommend you use a certified lab.
Right.
And most of the counties, as far as we know, are not certified labs. So and our lab certification program just came over to our environmental health division. So we're kind of with this tension between wanting people to make it easy for them to test because the counties will do it free or low cost, and also wanting to make sure they have good information. So what are your thoughts as far as having a certified lab versus just a county public health lab that probably can do nitrate and bacteria pretty easily but may not be certified?
So definitely at APHL, I mean, all of our state labs are certified, and they typically do that certifying. I'm not sure how many of the local labs aren't certified. My understanding would be that most of them are, but I guess maybe not. So, I don't know. I mean, the most important thing is that the testing gets done. But I would say if you can check out what the methods are, kind of go a little bit more deeply into how that lab is operating and what their results are, and try and get a sense of the quality and how defensible that data is, that might be a good idea. But you might also want to work with, suggest to them, ask them if they're certified and who they're certified by, and if not, can you, look into that certification with the state public health laboratory.
In Kansas, we have a link to all of our state certified labs for anyone to look up, and it tells what they're certified to analyze for. What I've found since I have taken this job is that there's only there's actually 5 or 6 labs that are certified that are willing to take private well samples and test them because of the expense for the bigger labs. So I had to create a sheet that I provide that lists those 6 or 7 private lab or certified labs that will do private well samples and provide that to the county sanitarians or the public. So
That's a good idea.
it's what I had to do. And then I always put at the bottom that check locally. They may be in a county that can do some screening, might have the ability to do some simple screening. Some of the bigger counties have bigger communities and have a more sophisticated lab facility that may or may not be certified.
Right. That's a good comment. And I mean, in an ideal world, every lab would be perfectly certified and accessible to everybody. But hopefully that's something that we can work more towards.
Any questions?
Okay, thank you.